What if lowering your blood pressure didn't require pills, diets, or even breaking a sweat? Just pressing play? Science shows that music isn't just background noise. It's medicine for your mind and your heart. The right melodies can slow your heartbeat, calm your nerves, and even drop your blood pressure within minutes. No prescription, no side effects, just the power of sound working in perfect harmony with your body. But here's the catch. Not all music helps. The wrong type can actually raise your BP and stress levels without you realizing it. That's why knowing which rhythms relax your blood vessels and which ones secretly tighten them is key. In this video, we'll break down exactly how music affects your nervous system, what the latest research says about its BP lowering power, the specific genres and tempos that work best, and how you can easily fit music therapy into your daily routine, starting today. By the end, you'll know how to turn your headphones into a health tool that works while you sit back and enjoy your favorite tunes. Let's start with how music actually talks to your heart and blood vessels, without saying a single word. The mind-body connection, how music affects the nervous system. When you listen to music, it's not just your ears that are involved, your entire body reacts. That's because music has a direct line to your autonomic nervous system, which controls automatic body functions like heart rate, breathing, and blood vessel constriction. How music calms the fight or flight response. High blood pressure is often linked to overactivation of the sympathetic nervous system, the part responsible for the fight or flight stress response. When this system is on overdrive, your heart beats faster, your blood vessels tighten, and your BP rises. The right kind of music can do the opposite. Slow, steady rhythms, especially those around 60 to 80 beats per minute, send calming signals to the brain. This encourages a shift toward parasympathetic activity, the rest and digest state, where heart rate slows, blood vessels relax, and blood pressure naturally drops. Why tempo and tone matter. Slow tempo helps synchronize breathing with the music, creating a relaxation effect. Low, steady tones reduce the brain's stress response. Minimal, abrupt changes keeps the nervous system from spiking alertness. In contrast, fast, loud, and erratic music can stimulate the sympathetic system, temporarily raising BP, breathing, and heart rhythm synchronization. Certain pieces of music can guide your breathing without you even realizing it. When you breathe more slowly and deeply, your heart rate follows, and your BP naturally declines. This phenomenon is known as respiratory sinus arrhythmia, and music can be a powerful trigger for it. The emotional factor. Music also triggers the release of dopamine, a feel-good chemical which can counteract stress hormones like cortisol. Lower cortisol means less vessel constriction and smoother blood flow. Music isn't just background entertainment. It's a tool that directly interacts with your nervous system to influence blood pressure. Next, we'll explore the science and real-life studies that prove music can lower blood pressure and how much listening you really need for results. The science. Studies linking music to lower BP. Music's effect on blood pressure isn't just a theory. It's been tested in hospitals, clinics, and research labs around the world. While results vary depending on the type of music and the listener's personal preferences, the science points to a clear trend. Certain kinds of music can cause measurable drops in BP. Landmark studies you should know. 1. The Florence study. Researchers at the University of Florence studied patients with hypertension who listened to calming classical, Celtic, or Indian music for 30 minutes daily. After just 1 week, their average systolic BP dropped by 4 to 5 millimeters of mercury and diastolic BP by 2 to 3 millimeters of mercury, similar to the effect of some first-line lifestyle changes. 2. Japanese Heart Institute research. A Japanese study measured the effect of slow-tempo classical music on elderly patients with high BP. Within 10 minutes of listening, both systolic and diastolic readings dropped significantly, and the calming effect lasted for hours. Third American Heart Association conference findings. At an AHA meeting, researchers presented data showing that pairing music with slow, deep breathing exercises produced even greater reductions in BP, sometimes as much as 7 to 8 millimeters of mercury in systolic pressure. Why the effects happen. Hormone changes. Music reduces cortisol, the stress hormone that constricts arteries. Vascular dilation. Calming rhythms promote nitric oxide release, helping blood vessels relax. Heart rate variability, HRV, improvement. Higher HRV is linked to lower cardiovascular risk, and music boosts it. Consistency is key. The studies show a pattern. Occasional listening gives temporary results, but regular listening over weeks or months compounds the benefits. 20 to 30 minutes daily seems to be the sweet spot. Results are better when the same relaxation playlist is used because the brain starts to associate those sounds with a calm state. Scientific evidence confirms that music can help lower BP, not as a replacement for medical treatment, but as a natural, enjoyable tool to support heart health. Next, we'll break down exactly which types of music work best for blood pressure control and which to avoid. Best types of music for blood pressure control. Not all music affects the body the same way. The wrong track can raise your heart rate and blood pressure, while the right one can calm your nervous system and relax your blood vessels. The key is to choose music that works with your body's relaxation mechanisms, not against them. 1. Classical music. Slow melodic classical music, especially compositions by Mozart, Bach, and Debussy, has been shown to lower heart rate and blood pressure. The predictable rhythm and lack of sudden loud bursts keep the brain and body in a relaxed state. Best picks: Mozart's Clarinet Concerto in a major, Debussy's Clair de Lune. 2. Nature sounds and ambient music. Recordings of rainfall, ocean waves, forest streams, or gentle wind can mimic the calming sounds our brains evolved to find safe. Adding gentle instrumental layers to these sounds enhances the relaxation effect. 3. Soft jazz and acoustic. Smooth, slow-tempo jazz or gentle acoustic guitar can ease tension without overstimulating the brain. Avoid tracks with overly complex rhythms or loud, sudden solos. 4. Traditional and cultural music. Familiar cultural or folk music can trigger a sense of comfort and nostalgia, which lowers stress hormones. This is especially effective if the songs are tied to positive memories. 5. Low BPM, beats per minute, tracks. For BP control, aim for 60 to 80 BPM, close to a healthy resting heart rate. Music in this range subtly encourages your heart and breathing to match the tempo, leading to a calmer state. What to avoid? Loud, high-energy music with rapid tempo changes. Heavy bass that stimulates adrenaline release. Songs with emotionally triggering lyrics that could increase stress. Pro tip: create a BP-lowering playlist of 8 to 10 tracks you can play daily at the same time, morning or evening, to train your body to relax on cue. The most effective music for BP control is slow, steady, and emotionally positive. Choose songs that your body and your mind naturally respond to with calm. Next, we'll cover how to fit music therapy into your everyday routine for maximum BP benefits. How to incorporate music therapy into your daily routine. Lowering your blood pressure with music isn't about occasional listening. It's about intentional, consistent practice. The good news? It's one of the easiest and most enjoyable health habits you can add to your day. 1. Morning reset. Start your day with 15 to 20 minutes of calming music before diving into work or news. This helps prevent the morning BP spike that's common in people with hypertension. Sit in a comfortable chair, close your eyes, and focus on the melody. Breathe slowly in rhythm with the music. 2. Midday stress break. If your workday gets intense, take a 5 to 10 minute music break instead of scrolling your phone. Choose instrumental tracks without lyrics so your brain doesn't stay in problem-solving mode. Pair with slow breathing for maximum effect. 3rd evening wind down. Listen to relaxing tracks in the last hour before bed. This signals your body to release melatonin, which improves sleep quality, a crucial factor in long-term BP control. 4. Pair music with other relaxation practices. Music's BP lowering power multiplies when combined with gentle stretching or yoga, meditation or mindfulness, aromatherapy with calming scents like lavender. 5. Keep it portable. Load your playlist onto your phone so you can use it during commutes, if not driving, waiting rooms, lunch breaks, travel. 6. Consistency over variety. While exploring new music is fun, having a core playlist you return to trains your brain to associate those songs with relaxation, making the BP lowering response faster over time. Music therapy works best when it's woven into your daily life, not treated as an occasional treat. Just 20 to 30 minutes of intentional listening each day can make a measurable difference in your blood pressure. Next, we'll discuss when music might not work on its own and why it should be part of a bigger BP control plan. When music might not work alone. Music can be a powerful tool for relaxation and blood pressure support, but it's not a cure-all. If your BP is consistently high, music should be part of a comprehensive plan, not your only line of defense. 1. Severe or uncontrolled hypertension. If your systolic BP is consistently over 160 millimeters of mercury, or your diastolic BP over 100 millimeters of mercury, music alone will not bring it down to a safe range. In these cases, medication and close medical supervision are essential to prevent serious complications like stroke or heart attack. 2. Underlying medical conditions. Kidney disease, thyroid disorders, and certain hormonal imbalances can cause persistent high blood pressure. Music may help reduce stress-related spikes, but these conditions require direct medical treatment. 3. Lifestyle factors that overpower music's benefits. If your diet is high in salt, you're physically inactive, you smoke, or drink alcohol excessively, the BP lowering benefits of music will be limited. In other words, you can't outplay a poor lifestyle. 4. Emotional state and music response. For some people, music may stir up emotions rather than calm them, especially if the songs trigger sad or stressful memories. Choosing the wrong playlist can have the opposite effect and raise BP. 5. The role of professional guidance. If you're using music therapy as part of your BP management, let your doctor know. They can help track whether your BP is responding and suggest other complementary methods. Music therapy works best when combined with a healthy diet, regular exercise, stress management, and, when necessary, prescribed medication. Think of music as a booster for your heart health, not the whole treatment plan. Next, we'll get into practical tips to make your music therapy as effective as possible and the mistakes to avoid. DIY music therapy. Tips and common mistakes to avoid. Listening to music for better blood pressure isn't just about hitting play. It's about doing it in a way that fully engages your mind and body. Music therapy works best when approached as a deliberate practice, not background entertainment. Below, you'll find practical tips to maximize its BP lowering potential and avoid the traps that reduce its effectiveness. 1. Create the right environment. Your brain and body need to be in receive mode for music to work its magic. If you're in a noisy room, your nervous system will still pick up environmental stress signals. Ideal setup. A quiet space, dim lighting, and comfortable seating or lying position. If you can't find silence, use noise-canceling headphones or earphones to block outside distractions. 2. Match music to your breathing. One of the most powerful BP-lowering mechanisms of music is its ability to synchronize your breathing. Choose tracks in the 60 to 80 beats per minute range. This pace is close to a healthy resting heart rate. As you listen, inhale for 4 beats, hold for 2, and exhale for 6. This combination activates the parasympathetic nervous system, reducing heart rate and BP. 3. Use a consistent playlist. Variety might be fun for casual listening, but for BP control, repetition is your friend. A consistent playlist trains your brain to recognize specific songs as relaxation signals. Over time, your body begins to respond faster to those cues. Keep this playlist separate from your workout or upbeat music to prevent mixed associations. 4. Time your sessions for maximum benefit. While music can help at any time, some moments in the day are particularly effective. Morning prevents the natural cortisol spike that can raise BP. Midday acts as a stress reset during work or errands. Evening helps transition your body into a restful, BP-friendly sleep state. Before stressful events, calms the nervous system before presentations, appointments, or travel. 5. Combine music with relaxation techniques. Music's impact multiplies when paired with other calming activities, gentle stretching or yoga. Aromatherapy, lavender, chamomile, sandalwood. Meditation or guided imagery. Warm baths or foot soaks. These combinations engage multiple senses at once, sending stronger relaxation signals to the brain. 6. Avoid multitasking. Scrolling your phone, reading emails, or watching the news while listening cancels out much of the benefit. Your brain stays in alert mode, keeping BP elevated. Treat music therapy like meditation. Be fully present in the experience. 7. Be aware of emotional triggers. Music is emotional, and not all emotions lower. BP is songs tied to grief, heartbreak, or stressful memories can raise BP, despite being slow or melodic. Instead, choose music that makes you feel safe, hopeful, and comforted. 8. Don't overstimulate your nervous system. Some relaxing tracks still have sudden crescendos, heavy bass, or unpredictable shifts in rhythm. These can jolt your nervous system into alertness. Opt for smooth, predictable transitions in volume and tone. 9. Keep track of your progress. Use a home BP monitor to see how your body responds to different tracks and durations. Take a reading before and after your listening session to gauge its effectiveness. Over weeks, you'll learn which songs have the strongest impact on your BP. 10. Make it a lifestyle, not a one-off. The benefits of music therapy build over time. Think of it like exercise. Missing a day won't ruin your progress, but daily practice delivers the best results. Aim for 20 to 30 minutes a day, even if you split it into smaller sessions. Common mistakes that limit results. Mistake 1. Choosing the wrong music. If it's too fast, loud, or emotionally intense, it can raise BP instead of lowering it. Mistake 2. Treating it like background noise. Passive listening while doing chores or scrolling social media is less effective than focused listening. Mistake 3. Inconsistent use. Skipping days or using music therapy only during stress spikes means you lose the compounding benefits. Mistake 4. Ignoring how you feel. If a song feels uncomfortable or agitating, even if it's slow, swap it out. Music therapy for blood pressure is simple, but it's also precise. By controlling your environment, choosing the right songs, timing your sessions strategically, and practicing regularly, you turn music from a pleasant hobby into a measurable health tool. The long-term heart benefits of music beyond blood pressure. Music doesn't just provide a temporary dip in blood pressure, it can have long-lasting effects on your overall cardiovascular health when used consistently. Let's look at how. 1. Improved blood vessel function. When you listen to calming music daily, studies show an increase in endothelial function. That's the ability of your blood vessels to expand and contract efficiently. Healthy endothelial function means better circulation, less resistance, and easier blood flow, which all help maintain healthier BP levels over time. 2. Reduced chronic stress load. High blood pressure often isn't about one stressful moment. It's about a constant background level of stress. Daily exposure to relaxing music can lower baseline cortisol and adrenaline levels, meaning your default state is calmer and your BP stays lower more consistently. 3. Better sleep quality. Poor sleep is a major contributor to hypertension. Calming music before bed has been shown to help people fall asleep faster, spend more time in restorative deep sleep, and experience fewer nighttime BP spikes. 4. Emotional resilience and mental health. Depression, anxiety, and loneliness are linked to higher BP and worse heart health outcomes. Music improves mood, creates a sense of connection, and provides a healthy coping mechanism for emotional stressors. Even singing along to your favorite calming songs can release endorphins, which not only lift mood, but also help regulate vascular tone. 5. Supporting exercise and recovery. Certain moderate tempo music can help you stick to a walking, yoga, or stretching routine, forms of exercise that are excellent for blood pressure. Post-workout, switching to slow, relaxing tracks helps your heart rate and BP come back down faster. 6. How long until you see results? Short term. Some BP reduction can be seen in as little as 10 to 15 minutes of listening. Medium term. Consistent daily listening for 2 to 4 weeks often results in measurable BP improvements. Long term. After 6 months or more, benefits like better vessel function, reduced stress load, and improved sleep can become part of your normal health baseline. 7. Making it a lifelong habit. Anchor music therapy to daily habits you already do, like morning coffee, commute time, or bedtime routine. Keep evolving your playlist so it stays enjoyable, but maintains the calming tempo and style that work for your body. Music isn't just a quick fix for lowering BP, it's a lifestyle tool that, when used consistently, can protect your cardiovascular health for years to come. Conclusion. Music is more than entertainment, it's a form of medicine your heart can hear. The right melodies calm your nervous system, relax your blood vessels, and help your blood pressure drift toward healthier levels. And unlike pills, music comes with no side effects, only benefits that go beyond your heart, improving your mood, your sleep, and your overall well-being. But here's the most important part. It only works if you use it intentionally. A calming playlist sitting untouched on your phone won't help you. You have to make music part of your daily life. 20 to 30 minutes a day, at least 5 days a week. The effects build over time, and what starts as a simple habit can become one of the most enjoyable parts of your health routine. So starting tonight, pick 3 songs that make you feel deeply relaxed. Listen with your full attention, breathe in rhythm, and let your body respond. Tomorrow, do it again. If you've learned something new today, hit that like button. It tells us to make more heart-friendly content like this. Subscribe for more natural, science-backed ways to protect your blood pressure, and share this video with someone who could use a little musical medicine in their life. Your health doesn't have to be all restrictions and rules. Sometimes it can be as simple and beautiful as listening to a song.